And welcome back. We've got a 1-0 game here in the semifinals, Warroad over Proctor Hermantown. Joining me now is Dr. Nick Anderson. He is a physician in family practice with Tria Health Partners, Park Nicollet, to talk a little bit about ACL injuries. Certainly hockey players are no stranger to that. We see it in football. Really, you see it just about every sport, especially contact sports.
Absolutely, yep.
And how do they happen? Is it because of the contact? Or sometimes you can have we see it in football a lot, a non-contact ACL injury.
Absolutely, yeah. It can happen without any contact as well. But typically an ACL injury happens when there's a twisting or turning force that's exerted onto the side of the knee. So in this model here, the ligament here on the inside of the knee, that's the ACL. So that band of connective tissue helps to stabilize the knee. So a lot of times it is contact coming from the outside of the knee, but just as often it can be non-contact, such as coming down from a jump or pivoting or a sharp cutting motion.
And how are they treated so that they can heal? You always read in the paper about famous athletes who have these ACL injuries, and sometimes it's 9 months, sometimes it's a year. How do you treat them so they can heal fast?
Right, so initially there's going to be a lot of swelling with that ACL injury, so the goal is just to get that swelling down. Over-the-counter anti-inflammatories like ibuprofen, naproxen, ice, get some compression on there, get the leg elevated. That's going to be helpful. After that, you would want to be evaluated by a healthcare provider, and they can help confirm the diagnosis and then also coordinate treatment. In a recent study, about 77% of ACL injuries ultimately required surgery. So especially in younger athletes, to get that optimal outcome, you're probably going to need surgery.
Now, there's a lot of young athletes, I'm sure, out there watching along with their parents. What's the best way for athletes, and especially young athletes, to prevent an injury like this, to maybe build up the muscles around the ACL?
Yeah, so it turns out there's a lot of training regimens and pre-workout regimens and warm-up routines that incorporate stretching exercises to treat any muscle imbalances, and that can help reduce the risk of ACL injuries. So getting in to see a sports physician or a physical therapist to have a tailored regimen set up is really important. Usually the younger athletes are going to do better with these because they can incorporate that kind of better as they go on throughout their life, and hopefully that's going to allow them to reach their maximum athletic potential without any major injuries.
All right, Dr. Nick Anderson, thanks for the great information that will be helpful, I think, to a lot of athletes. Our coverage of this exciting semifinal game will continue after a break.